First of all, thank you very much for being here and thank you for inviting me. It's nice to see Dr. Gibson again after 10 years, maybe, 1993. As I was going through, I was looking at certain literature, and I'm not sure whether the Scottish Journal of Medicine is the journal, but in the journal it stated, looked at their outpatients in rheumatology and looked at whether they had any disease, renal disease associated with it, in which they had not suspected it. And they found that 18%, and slightly more than 18%, had what is known as chronic kidney disease 3 or more. And briefly, chronic kidney disease is the definition of renal diseases, which is now based on 5 categories. And you don't have to have a high creatinine to go into chronic kidney disease. So even structural change would cause kidney disease, and then proteinuria and so on and so forth. So if the question is, if you look at people who have visited any clinic, and mainly rheumatology clinics in this instance, one may find that there are instances where we have not picked up diseases which are likely to happen. And kidney disease is one of them. Rheumatology and nephrology share quite a lot. I mean, there are certain diseases which are clearly affect or are seen by both nephrologists and urologists. We'll talk briefly about those, but we'll talk mainly about those diseases that rheumatology would see, and would want to make sure that the renal manifestations, the renal problems are taken care of. So briefly, I'm just going to talk about how do we recognize renal involvement, and probably for juniors here, to how to look at those tests and how to interpret them. And what are those things that cause renal diseases, mainly drugs that we all use, and certain diseases which are common, and then a brief take-home message. So, Pearman's biopsy, or a liquid biopsy, urine examination. Unfortunately, not done as often as it should be. It tells you a lot. A normal urine examination may not exclude everything, but an abnormal one definitely includes many things that can be picked up. There are many other tests that we do for renal functions, which are urea, creatinine, ultrasounds, DTPA, and so on and so forth. We'll briefly talk about urine first. What we are looking for in urine is chemical examination, biochemical examination, appearances, and then finally microscopic examination. And the importance of looking at protein presence is extremely important. One thing we need to be sure is that when you look at urine examinations in a normal, what we call here as routine examination of the urine, or a urine DR, a detailed examination of the urine, it's looking at a test sensitivity which is not huge, which means if you have small quantities of, say, proteins, it will not pick up. But if you have reasonable quantities of protein, it will pick up. And so the importance of the sample that one gives, we tend to ask people to drink a lot of water and give urine. Unfortunately, that spoils everything. It dilutes everything. Once things are diluted, it's difficult to pick up. So the best samples would actually be a second void sample, which is slightly more concentrated than a diluted sample because it picks up more things. For protein, if you pick up a protein on a dipstick examination or a routine examination, it tells you that the person has at least 300 milligrams per deciliter of protein. And it unfortunately doesn't quantify it. So it just tells you it's there, but you cannot quantify. So a 2+, 3+, 1+ is immaterial. It depends upon what your concentration of the urine is. It just tells you it's there. One thing important to realize is that there are many medications, drugs, and other things that can also cause protein to come into urine. Not necessarily because the kidneys are damaged. Protein is essential because it tells you that the vasculature has been involved by inflammation or any other thing, and the leakage of protein from the glomerulus has occurred. Normally it doesn't happen. So drugs like aminoglycoside, drugs that Bushra uses, amphotericin B, penicillin, cephalosporins, all have been implicated in proteinuria. Fever, exercise, posture, many other things are also implicated. The only way that you know the quantity of protein is either to collect the protein for 24 hours and then see into it, cumbersome, difficult, You really don't know whether somebody is actually collected a 24-hour sample or not. But a simple test to look at a urine protein ratio, urinary protein to urinary creatinine ratio. We just tell you, looking at a constant which you secrete every day, all the time, which is creatinine in the urine, and you look at a protein and you divide it. So you divide the urinary protein by the urinary creatinine and you get an approximate 24-hour estimation, which gives you the accurate, as accurate as can be for what one must be leaking over the 24 hours. It doesn't matter whether the urine is diluted, because the constant, which is your creatinine, will be diluted, and so would the protein, also your ratio will remain the same. Microscopy, essential. It tells you about whether somebody is leaking other things apart from protein, like red blood cells, WBC, cast and crystals, which gives you an indication of either the inflammation that's going on within the kidney, as well as the other rheumatological diseases that may have taken place, or whether it's just protein or a drug-induced thing. Renal function tests that we normally use are BUN, urea, creatinine, which looks at renal function, or are things that look at how we estimate a glomerular filtration rate, which is the renal function. Urea, easily done, cheaper test, has limitations because it is reabsorbed as well as secreted, plus also changes with dehydration, diet, and other things. Creatinine may be a better marker, which looks at GFR. The issue, if you want to do an accurate estimation of somebody's renal function, you would want to do what is known as a creatinine clearance, or actually do a GFR or inulin clearance, which are both either not available or difficult to do. And a creatinine clearance, as we said, depends upon how much urine you collect. 24 hours have to be collected.